This is the Coronavirus Daily Briefing for Monday, March 16th, 2020. I'm Brian McCullough. All the news from the weekend. Are young asymptomatic cases the key to spreading the virus? Should we rethink the conventional wisdom around face masks? How long can the virus stay on surfaces, and how long can we rely on Amazon delivery? As of last night, known cases of coronavirus in the United States exceeded 3,500, spread across 49 states, prompting the mass cancellation of events and the reordering of American public life. The CDC is recommending halting gatherings of 50 people or more throughout the U.S. for the next 8 weeks. If implemented fully, that means all sporting events, all concerts, all conferences, all parades, all weddings, almost everything done for 8 weeks. Bars and restaurants are closed in New York City beginning tomorrow, Tuesday at 9 a.m. Takeout and delivery orders only. New York City schools have closed. Ohio has suggested schools might remain closed in that state for the remainder of the academic year, but Ohio, Massachusetts, and Illinois have gone the France route as well. All bars and restaurants are shutting down statewide. Quote, delay means more people will die, Ohio Governor Mike DeWine said. These states are the first U.S. states to take the steps toward Italy, toward a complete shutdown of public activities except for food, medicine, and other essentials. It is unlikely they will be the last. The CEO of Universal Music Group, Lucian Grange, perhaps the most powerful man in the music business, has been hospitalized after testing positive for COVID-19. Apple CEO Tim Cook and Apple Services Chief Eddie Q attended Grange's 60th birthday party 2 weeks ago. In shocking news, but I guess we can't be shocked anymore by anything as it's all probably going to close down, MGM is shutting the following Las Vegas properties beginning March 17th. Aria, Bellagio, Excalibur, Luxor, Mandalay Bay, MGM Grand, Mirage, New York, Park MGM, and Vdara. So that's basically the entire Vegas Strip. Other companies closing stores or reducing hours: Nike, Warby Parker, Allbirds, Urban Outfitters, Apple, Patagonia, and Glossier. Walmart is partially shutting down 24-hour locations, which will operate 6 a.m. until 11 p.m. until further notice. Starbucks is moving to what it is calling a to-go only model. You can still walk up and order at the Starbucks counter or via drive-thru or delivery, but you can't stay and sit in the cafe or patio areas. French luxury company LVMH said it is rejiggering its cosmetics division to only produce mass quantities of hydroalcoholic gel in order to give it to French health authorities. More people have now died from the coronavirus outside of China than have died inside China since the disease first emerged. Airline Cathay Pacific is adding flights from U.S. cities and London to Hong Kong because, since the disease seems to be relatively under control in Hong Kong at the moment, some people are seeing Hong Kong as a safe haven and are rushing to travel there. A mere 7 weeks ago, Hong Kong had implemented travel restrictions because of its proximity to mainland China. Italy reported 368 deaths in a single day yesterday, a 25% increase, making this the deadliest 24-hour period thus far, worse than the deadliest day in Wuhan's outbreak. Italy has reported 200 deaths for each of the last 3 days. Italy only had its first corona-related death 3 weeks ago. Now more than 1,800 people have died. Because of overloaded hospitals, the fatality rate in Lombardy is 9%. In the rest of Italy, the fatality rate is 5.1%. Spanish health authorities reported 2,000 new coronavirus cases in 24 hours on Sunday, bringing the total in the country of Spain to 8,000 cases with 288 deaths, as the number of people who have died of the virus more than doubled in 24 hours. As the Spanish death toll was up from 136 a day earlier, that is an increase of almost 100%. Spain is clearly on the Italian trajectory. Is France next? It certainly seems to be going that way, quoting the New York Times. France announced the closing of all non-indispensable businesses, including restaurants, bars, and movie theaters, after a sharp uptick in coronavirus cases. The number of French cases passed 5,420 on Sunday, with 127 deaths. On Saturday, 300 coronavirus patients were in critical condition, half of them under 60 years of age. On Sunday, France's transportation minister said the country would begin reducing plane, train, and bus services between cities, end quote. I'd like to end this segment with some potentially good news from Italy. Adriano Aguzzi, a professor of neuropathology in Switzerland, just north of the troubled Italian region of Lombardy, tweeted a chart this weekend that showed that even with the surge in deaths in Italy over the last few days, the death rate is deviating ever so slightly from exponential growth. It's early days, but the lockdown might be beginning to work. Link to the chart I'm referencing in the show notes. And Chen Iwuha, the European bureau chief for China Daily, tweeted this, quote, "Just read that Chinese medical team sent to Italy to fight COVID-19 comprises mostly experienced doctors from Sichuan. Sichuan folks still remember how an Italian rescue team during the devastating 2008 Wenchuan earthquake saved many lives. The world needs more of us helping each other," end quote. There has been a lot of justified, I think, hand-wringing about the scenes of people going to bars and restaurants, even to Disney World this weekend, seemingly unworried about anything that is going on. This is obviously a problem for one big reason: potential transmission from people who might not know they already have the disease. Indeed, there is increasing evidence that it is young people, people without symptoms, that might be the key driver of the spread of coronavirus, even more so than we realized, quoting CNN. New studies in several countries and a large coronavirus outbreak in Massachusetts bring into question reassuring assertions by U.S. officials about the way the novel virus spreads. It appears that a Massachusetts coronavirus cluster with at least 82 cases was started by people who were not yet showing symptoms, and more than a half dozen studies have shown that people without symptoms are causing substantial amounts of infection. Several experts interviewed by CNN said while it's unclear exactly what percentage of the transmission in the outbreak is fueled by people who are obviously sick versus those who have no symptoms or very mild symptoms, it is becoming clear that transmission by people who are asymptomatic or mildly symptomatic is responsible for more transmission than previously thought, end quote. Indeed, scientists seem to be coming to the conclusion that this is what makes coronavirus so insidious. It can spread far before it even sickens. Both MERS and SARS tended to be only spread by symptomatic people, but if you get COVID, you might have spread it to 50 other people before you even know it. Add to that what we've previously discussed about how scientists suspect that you're more contagious earlier on in the disease. In a study of 24 passengers who had just flown from Israel, 7 tested positive for coronavirus, of which 4 had no symptoms, and the viral load of specimens from asymptomatic patients was higher than from the 3 patients who had symptoms. Thus, the global move toward social distancing. Stay home, stay out of large crowds, stay out of small crowds. There's a link to a chart in the show notes that shows the difference between 2 towns in Italy. The 2 towns are Bergamo and Lodi. Lodi actually had the first COVID-19 case reported before Bergamo reported its first. But Lodi shut down their town February 23rd. Bergamo waited until almost a week later. By March 13th, Lodi only had around 1,000 cases of coronavirus, and those case numbers seem to be leveling out, while Bergamo has seen case numbers shoot up to 2,500. And young people, I'm talking to you, data from South Korea, where they test everyone they can, is suggesting that 30% of the carriers in that country were aged 20 to 29. If that's not enough to convince you, let me point you to an actual animation. It is literally just balls dancing around an environment randomly, representing infections over time. Look at what happens to the infection curve when only a quarter of a population continues to circulate and 3/4 of a population practice social distancing. The infection rate is significantly slowed, and with extensive distancing, with 7/8 of a population staying home, the infection curve is stopped almost in its tracks. These are powerful animations, but they are only animations, only simulations made to educate on a concept. The concept is, however, this is no joke. If you can, stay home. Let me quote the last paragraphs from the story accompanying the simulation. Quote, "In one crucial respect, these simulations are nothing like reality. Unlike simulations, COVID-19 can kill. Though the fatality rate is not precisely known, it is clear that the elderly members of our community are most at risk from dying from COVID-19. Quote, if you want this to be more realistic, a scientist was quoted after seeing a preview of this story, some of the dots should disappear, end quote. Link to the simulation is, of course, in the show notes. Questions are being raised as to whether or not more of us should be wearing face masks, even if we're not showing signs of coronavirus infection. Authorities in China already mandate the wearing of masks in all public places, whether or not people are sick or healthy. Quoting from Inkstone, since late January, Chinese authorities in major cities have enforced rules on wearing face masks in public spaces, including detaining those who tried to use public transport without a mask, end quote. In South Korea and Japan, it is also required that masks be worn by healthy people in crowded places. But in much of the rest of the world, including here in the US, it's advised that only people displaying symptoms should wear masks. As just mentioned, the possibility that coronavirus can be spread by asymptomatic people is causing some to argue for more widespread use of masks. Quoting again from Inkstone, asymptomatic transmission has been reported in multiple countries in which a spreader is responsible for sickening others without knowing it. In January, a cluster of 13 infections was believed to have started with a British man who contracted the virus during a trip to Singapore and spread it to others on a skiing trip in the French Alps and back home in the United Kingdom, all the while showing no signs of infection himself, end quote. Researchers writing in The Lancet suggested that, in light of this, current national advice may need updating to deal specifically with coronavirus. Quoting from the piece, if everyone puts on a mask in public spaces, it would help to remove stigmatization that has hitherto discouraged masking of symptomatic patients in many places. Furthermore, transmission from asymptomatic infected individuals has been documented for COVID-19, and viral load is particularly high at early disease stage. Masking, as a public health intervention, would probably intercept the transmission link and prevent these apparently healthy infectious sources, end quote. All of that said, as of right now, the advice remains to only wear a mask if you are displaying symptoms, helping to conserve the mask as a resource. Masks are in short supply and are needed for medical practitioners who require them more than the rest of us in order to safely treat people, not get sick themselves, and thus stay on the job. A new study has revealed the length of time that COVID-19 can remain viable on common surfaces. The study, so new that it is yet to be peer-reviewed, found that coronavirus was, quote, most stable on plastic and stainless steel, with viable virus being detected up to 72 hours on those surfaces after application. It can also remain viable for up to 24 hours on cardboard and up to 4 hours on copper. The researchers noted that these decay timings were similar to those found with the 2002-2003 SARS virus, suggesting that, quote, differences in the epidemiology of these viruses likely arise from other factors, including high viral loads in the upper respiratory tract and the potential for individuals infected with COVID-19 to shed and transmit the virus while asymptomatic, end quote. There are presently 274 surface disinfectants approved by the EPA for use against COVID-19. Link to the list is in the show notes. At this point, with store shelves increasingly bare, I'm sure a lot of us are continuing to rely on delivery, especially Amazon Prime delivery, to keep ourselves stocked up with everything we need so that we can shelter in place, avoid going out to stores as much as possible, and just generally socially distance. Well, an article in Vice's Motherboard talking about the broader strains to workers in the sorting facilities and also the people who have to deliver our stuff makes the point that maybe our delivery systems are in danger as well. Quote, Motherboard spoke to Amazon logistics and labor experts who say it's only a matter of time before Amazon's Prime signature 2-day delivery promise faces serious delays, mistakes, and widespread shortages due to increased demands from consumers. Also, pressure on workers to meet rising production quotas, restrictions on trade, and the possibility of fulfillment centers being shut down as coronavirus spreads. Amazon's warehouse workers say they're already seeing increased workloads, while fewer of their colleagues are showing up to work, according to labor organizers. Already, Amazon's white-collar workers have been asked to work from home, but that's obviously not an option for warehouse fulfillment workers and delivery drivers. Quote, "It seems really likely that Amazon's Prime delivery system will falter," Daniel Flaming, president of Economic Roundtable and an author of the 2019 report on Amazon's economic impact on Southern California, told Motherboard. "One day, deliveries may not be made within one day. If the workers who do show up to warehouses are more stressed and given bigger routes and are possibly less experienced, incorrect deliveries will be made. The last mile segment of the delivery is very labor intensive," end quote. Flaming adds that we're likely to see a close parallel of what happens in Amazon warehouses during the holiday rush: increased delays, mistakes, and bottlenecks. "It would seem to me most likely that we'll see a drop in reliability and timeliness," end quote. But more than that, the fear here is the same with the health system, basically. If too many people involved in the Amazon delivery chain are even temporarily sidelined by the disease all at the same time, it's possible that even Amazon delivery could go down, to say nothing of the potential disruption to the supply chain, i.e., if even Amazon can't source enough goods to deliver to you. Existing drugs designed to reduce immune response could actually be an essential weapon in the fight to save vulnerable coronavirus patients at risk of death, new studies from China suggest. Writing in Vox, two University of Alabama doctors, Randy Cron, director of the Division of Pediatric Rheumatology, and Dr. Wynne Chatham, director of Rheumatology Clinical Services, said, quote, "Critically important studies emerging from China suggest that for many patients who die of COVID-19, it may be their own immune system rather than the virus itself that deals the fatal blow. This is called a cytokine storm. During a cytokine storm, an excessive immune response ravages healthy lung tissue, leading to acute respiratory distress and multi-organ failure. Untreated, cytokine storm syndrome is usually fatal," end quote. But here's the good news. Testing for a cytokine storm or overactive immune response is quick and readily available and could be made part of the testing regimen for patients newly admitted with coronavirus. Furthermore, we already have medicines designed to treat a cytokine storm brought on by viral infection, which may be more appropriate to use instead of less selective immune response lowering drugs like corticosteroids. Quoting again from Vox, "Recently, a number of specific anti-cytokine approaches have proven effective in treating a variety of cytokine storm syndromes, including those triggered by viruses. Those include drugs targeting interleukin-1 and interferon gamma. While randomized trials will be needed to confirm which, if any, of these therapeutics will effectively treat COVID-19 infected patients with cytokine storm syndrome, an IL-6 blockade has recently been reported to be of use in China, with successful outcomes in some individuals receiving this as part of their treatment," end quote. Fierce Pharma reports that Roche's Actemra, which is approved in the U.S. for the treatment of rheumatoid arthritis as well as cytokine storms caused by immunotherapy, is the drug being used in China that has had some successful outcomes. Doctors Cron and Chatham concluded, quote, "We must use all the knowledge at our disposal to treat these patients most at risk of dying, including from COVID-19-induced cytokine storms. For this to occur, the medical community must first be aware of the possibility, then make the diagnosis, and finally treat infected individuals with overly acute immune responses that are harmful, if not fatal, left untreated. This should help save the lives of those unfortunate individuals at risk of COVID-19-induced cytokine storm syndrome," end quote. If you missed it, we had an interview with an emergency department doctor on the ground in Seattle over the weekend. Check your podcast feed for that if you missed it. Today's episode was written by myself and James Welsh, as well as Jackson Bird, edited by James Welsh and Jackson Bird. This is my first day recording from home. That's why it sounds a little different, if it sounds different at all. I should have successfully cloned my usual recording studio setup by tomorrow or Wednesday at the latest. Talk to you tomorrow. Be well.